Mairead, seems there's a few psychological issues. She's frightened of recurrence and really worried about it. She's getting, obsessed about that, understandably. And Peter Grant's referred Arabella to you.
Hi, Arabella.
Hi.
I'm Mairead. I'm the psychologist.
Hi.
So Kath asked me to see you because you've been having some problems with intimacy and some concerns about coping after treatment.
Mm-hmm.
What do you think are some of the more important issues that you'd like to talk about today?
I've just been freaking out the last couple of months that, because it's like everything started becoming good again. And then I found out one of the girls that was in hospital at the same time with it as well. She's now come back. And so now I've just been freaking out, thinking, I don't want it to come back.
Yeah, and that's you focusing on that a lot.
Yeah, and I just, I keep thinking about it. And, the doctors keep saying, no, you're fine. Like, it's really rare, she just got really unlucky, it's probably not going to come back. You're all good. But it's like, but I had it once. What's to stop it coming back?
Yeah, and is that something that's keeping you awake at night?
Yeah, it's been stressing me out.
And do you think that your mood's gone down since your friend has had a recurrence?
Yeah, I mean, because she was all good, to have gone through it all together and both be moving on, so to speak. I mean, moving on as much as you can, like not in the same sense that all our friends are moving on, but you're sort of starting to get back on top of it, and now all of a sudden she's back to square one.
And what do you think upsets you more, worrying about what's going to happen to her or what's going to happen to you?
Well, I'm worried about her, obviously, but at the same time, it's
you.
Yeah, I don't want it to come back.
There's a few things we can do to help relax you a little bit and help reduce some of this distress that you're having.
Yeah, I feel like I'm so stressed, I'm going to bring it back.
What happens when you're stressed? What sort of things are happening? So you're losing sleep, you're low mood.
Yeah, I was snapping, so I've got this new boyfriend and I don't know why he's still here, but, I could get really snappy at him and just, feeling like I'm going to panic and...
Have you had any panic attacks?
I don't think so, but sometimes I just kind of, I don't know, I just feel like I'm getting out of control with worrying.
Okay, so you can't control the thoughts.
Yeah, and it's not even just that I'm worried about, it's all this other stuff, like, like should I be trying to have a baby with Mike, before the window's gone? Is it going to work? What's going to happen with that? But
So you've got lots of thoughts crowding in. Have you ever tried writing out some of these worries and trying to sort of, for want of a better word, thrash them out and just...
Not really. I just kind of stew over it and it just goes around and around and, I'm sort of watching everybody get married and have kids and
that's upsetting.
Yeah, I'm like, where's my turn?
Yeah, and it will come. It will come.
I don't know.
But it's normal that you feel that way and it's normal that you compare yourself to others, but it's important that we try and get a hold of these thoughts and contain them. So writing some of them down when they happen, and more often than not it happens at night and interrupts your sleep.
Yeah, it happens at night, waking up, and then one thought just sort of leads on to another
and spirals. And
spirals out, and I think if it comes back, then what's going to happen there? Like I definitely probably will never be able to have a baby. Mike will probably leave, that'll be the second guy that's gone and left me because of this.
So the baby thing is a real big issue. I'm noticing that you've shifted a little bit from fear recurrence to the baby.
Well, yeah, because my friends, that's all they're all doing now.
Yeah. Have you explored fertility options?
Well, I don't know, not really. I mean, we haven't been dating that long. Like, it's only been like 4 months. I'm not real sure. And, like, I don't want to sort of him to commit to anything while I'm still not sure what's going to happen in my future. Like, I don't, if I get sick again, and then it's like if I have a baby and it comes back.
Thank you very much indeed.